Now we'll be talking about fentanyl. Now we know that fentanyl is one of the best analgesic that is present out there. Now we must know that this is a synthetic opioid, and opioids are very strong painkillers. They're excellent analgesic because they act on opioid receptors in the brain. So they are centrally acting, means acting in the brain. Now, we must know that this fentanyl is 80 to 100 times much more potent than morphine. So, it is one of the excellent choice that is available in ICU at all the time for any type of pain. Uh, it is very much potent when compared for analgesia as well as for respiratory depression. It can definitely cause respiratory depression. Now, it has a very marginal effect in cardiac contractility and on heart rate. That is the reason why it doesn't potentiate much of a hypotension or bradycardia at all. It has excellent lipid solubility, so it enters brain very rapidly, and the peak analgesia is found within 5 minutes after IV. That is the reason why the analgesic effect of this medicine is excellent. The duration of action of this medicine is around 30 to 40 minutes. After that, it gets redistributed. That is the reason why this can be repeated once if it is needed. Most of the time, this medicine is not needed to repeat it within 1 hour. Most of the time, a single IV dose for an hour suffices. So it's very commonly what how much dose we give. We give 50 micrograms. We take 50 micrograms, we dilute it in 10 ml of NS, and we usually give around 3 ml, 4 ml, 5 ml, or 6 ml, depending on the intensity of the pain. This diluted 10 ml can be given like after 3 ml, we can give again after 1 to 2 minutes, we can again give if the patient doesn't get much good relief within 5 to 10 minutes. Any pain, this is excellent medicine. That can be cardiac pain, that can be post MI pain. This is very important analgesic, especially after MI, because after heart attack, patients are so much stressed. They are in the pain, and this pain will increase the cardiac output. It will increase heart rate, and this increases LVF as well. So to alleviate that severe pain, this can be an excellent choice. So I just told this 1 to 2 ml, that is 50 to 100 microgram, is diluted in 10 ml, and we can give around 3 ml or 4 ml or 5 ml or 6 ml slowly over a period of 1 to 2 minutes. In some patients, it can cause giddiness. In some patients, it can cause hypertension. That is the reason why we dilute this and we give it slowly over a period of a minute. It gives profound analgesia, that is the excellent property of this medicine. It is also used as an adjuvant to sedation and paralytic agent for almost all the patients in intubated, all the intubated patients, because in intubated patients, the ET2, EDT or tracheostomy tube is very irritable substance to have in the mouth. That is the reason why patients may remain awake, they may remain irritable, and they may resist the ventilator. That may increase the ventilator and patient's dysynchrony. So very commonly, those patients who have post craniotomy status for road traffic accidents, intracranial hemorrhage with mass effect with midline shift, large ischemic strokes with edema, or any brain lesion with mass effect. So, or those patients who are intubated with high ventilatory need, who are very irritable, and those patients who need sedation and to reduce the irritability, this fentanyl, how we very commonly use, we use 3 ampoules of Fenta, 3 ampoules of Atra, and whatever remaining is, we use Midas. And then we continue this at around 5 to 6 ml per hour. Most of the time, around 6 to 8 ml per hour of this infusion suffices to all the patients. And in between, boluses of this solution can be given. So this is one of the most excellent medicine for acute LVF, to relieve the pain, to relieve the anxiety, for any pain like any fracture pain, gastritis pain, rib pain, bone pain, back pain, muscle pain, joint pain, any type of pain, especially in ICU. Fentanyl is an excellent choice, as it also reduces the air hunger and dyspnea, especially in acute LVF patients. It may slightly depress respiratory center, but it is usually not requiring that much and dosage to cause respiratory depression. As I told ki it cuts down the sympathetic stimulation, so it calms the patient. That is the reason why it reduces cardiac workload by reducing heart rate as well. So this is one of the excellent medicine for analgesia. That's all.